Okay, I think we're live streaming now, so I want to welcome everybody. Good morning. Welcome to this rainy day. At least if it's going to rain, it's the middle of the week. Hopefully it'll be beautiful later on. I know it's at least warm and it's springtime, but want to welcome everybody to our meeting for the Health and Wellness Advisory Committee for March 6, 2024. Springtime's pretty close now, and we've had, of course, we had the rain is washing away the pollen, but pollen season, Cooper River Bridge Run is exactly 1 month away, be April 6th, and Paul's going to be very, very busy getting that all prepared. We got Wine and Food Festival happening, I think, starting tomorrow. So, and of course, everybody remembers to please spring forward on your clocks as we have daylight savings time coming into effect. So thank you all for being here. I appreciate it. Unfortunately, the mayor had another meeting he had to be in. It's a department head meeting, so we're also going to be missing Lori Yarborough and Jason Kronsberg as well. I know that Kimbo Lee and Adrian Holmes also apologized. I think they had conflicts this morning and weren't able to make it, but I do appreciate everybody being on here. And I guess the next agenda on the item, or the next item on the agenda, is our committee minutes for February 7th, 2024. Can I get a motion for someone to approve those minutes, please?
So moved.
All right, we have a motion to approve the minutes. Do we have a second, please?
I second.
All right, thank you. So all in favor, please say aye. Aye.
Aye.
Any
Aye.
opposed? The meeting minutes have been approved, so thank you very much for that. So first up, we have Dr. Susan Johnson, our Director of Health Promotion, College of Health Professions at MUSC, and she's going to talk to us about obesity in South Carolina.
All right. Thank you, Kevin and Paul. Can y'all see my screen?
Yes.
Yes.
Great. So Paul had asked me to provide an update. I was invited by SE Bio to serve on a panel for a symposium. This was back at the end of March. It was held in Columbia. And the topic was having a conversation about the impact of obesity. And really, I was really impressed with the attendance. For one, it was held at the ballroom at the Palmetto Club, and it was really standing room only. And just the diversity of attendees and panelists. So obviously it's a very hot topic, and in particular, we had representatives from Eli Lilly and Novo Nordisk, and really wanted to just have full transparency around, kind of the current state of medications and really understanding the impacts from an employer perspective, and then the financial impact from policy and state. So this is the agenda of the day, the symposium. So you can see, I'll just give you a minute to kind of look through the representation and the topics of the panels. I was asked to serve on the actionable steps, and I really focused on the work site perspective. But what I want to focus on today, because I do also have something else, I've got a groundbreaking that I've got to go out in the rain to go to. I wanted to just give a little update on a report that was shared at the symposium on the economic impact of obesity in South Carolina. So I am just going to go over really high level some of the statistics that were shared. And again, this report just came out this past month, and there you can copy down the information, but we can also share out the PDF and the link because there's a lot of great information, and it was very specific to South Carolina. And then I'm happy to come back at another time if you want to dig a little bit deeper into the details about strategies for work sites. I always give a plug for our South Carolina Healthy Business Challenge, but we actually last year, I believe, we did our seminar series on weight bias in the workplace and talked a lot about obesity and kind of the impacts in the workplace. I will touch on that a little bit, but if it's something that is of interest, there are resources to support that. But I wanted to just start out with some statistics. So this is data from 2022, and we can just look across the nation and see where we land in comparison. And this is probably not anything new to y'all, but I just wanted to kind of share it as a so to frame our conversation as far as where we are. And obviously this is a concern for our nation, but in particular, if you look at the Bible Belt and the Stroke Belt, we are right there in the center of that. So it is certainly of concern. And then this is a website that Paul has shared with us multiple times, and it's a great resource. But I wanted to just kind of tap in and zero in on what's happening locally. So this is for Charleston County, and this has not been updated since 2020, but I would venture to guess that, if we compare that to the previous map, that we're probably holding steady, hopefully coming down a little bit, but that's still, I think it's obviously something of considerable concern. So providing that information, then I wanted to go into just a little bit on this report and looking specifically on how obesity is impacting South Carolina's economy and labor force. So again, this report was unveiled at the symposium and is available online now. So just looking, and this is more recent data, which is great. Looking at the state of South Carolina, and these are economic impacts. And I think, oftentimes when we talk about chronic disease, we really narrow in on just the healthcare costs. But what I really like about this report is that it takes a much broader view and looking at it from both a statewide policy perspective and then an employer perspective and what those costs really are. So I think this is a really good resource for us because oftentimes we know that there is a significant cost, and the obesity also is, if we want to look at it as a disease within itself, but also contributes to diabetes and heart disease and other chronic diseases. So I think this is really good information to have because it's very specific to obesity and in some of these different areas that we wouldn't typically look at. So reducing economic activity, let's really focus in on that. And it's really interesting to see how obesity impacts these things. So I think, again, instead of looking specifically at the healthcare costs, let's look at what happens in the workplace. So significantly higher costs around absenteeism and disability. Fewer working adults in the workforce for a variety of reasons, for folks who are dealing with the consequences of obesity. And then from a state budget perspective, public assistance, state, PIBA, all of our state employees, Medicaid, tax revenues that are directly related to the employers. And the money that we're spending on healthcare around obesity that could be redirected to other purposes, which we all know that there are other needs in our state that we would much rather have those funds available to address. And then digging in a little bit deeper. So economic impacts for obesity tend to, we see some disparities here, and in particular with women earning 9% less than women at a healthy weight. So, we already know that there are disparities among for earning across gender, but then you factor in obesity, and that really increases that gap. And then employment, we also see less participation in the labor force. So lower for men, even more so for men, and then women compared with prospective employees at a healthy weight. So they're for a lot of reasons are not, they're just opting out of the workforce for a variety of reasons. And that is, really translated to dollars of potential earnings. And then of course we can't not look at the health implications of increased mortality. So premature deaths, that's really to me shocking, but it shouldn't be, but that number is to me unacceptable that we have close to now 10,000 South Carolinians per year experiencing premature death related to obesity. And again, there is a monetary component to that as well. But for me, just being in health promotion and healthcare, I hate to see that number. And then the costs for households. So these folks are already struggling because of, maybe not being in the workforce or, their earning potential is less. And then, add to that those increased medical costs. So higher spending within their households adds to that burden. And then let's look at the employer impact. And I think this is really important for us. And again, this is kind of my wheelhouse and really want to continue to provide resources to employers about, how is this impacting their bottom line and, in a variety of different ways. So, mentioned absenteeism, but we also know it's not just absenteeism, but presenteeism. And presenteeism is where your employees are at work, but they're not able to work and be as productive as possible because they're dealing with personal issues, could be mental health or physical health. So, both absenteeism and then the disability costs as well. So that has a direct impact on the employer. Higher healthcare costs, obviously, and then we're going to provide a few recommendations here as well. So what can employers do? And this is really high level. Again, I'm happy to come back at another meeting and dive a little bit deeper into this. Really, that was what our panel was to focus on what are some things that we're doing now that we're doing well, and how can we continue to work together. But just focusing on this report, insurance coverage and wellness programs, and making sure that we are consistent with obesity conditions, consistent with other chronic diseases. So whatever we're doing related to diabetes or, heart disease or any of those other chronic diseases, there should be consistency and parity with obesity care. Support and inclusion that accommodates the needs of employees with obesity. And this is, again, we really focused on this in our Healthy Business Challenge seminar around weight bias. And it was a real eye-opener for me. That might be something that this group might be interested in as well. And then education and resources for employees. And then for state and local governments. So this is a particular interest, I think, for the city. To again, just be aware of the costs. So really no different than what we're seeing statewide, on the state government and for employers, it's kind of those same areas of increased spending related to Medicare, healthcare costs. You see that state and local government, and then the public assistance programs that may or may not be offered through local or state government. And then recommendations. So this is specifically for state legislators, but something to think about from a city perspective is really promoting insurance coverage for comprehensive obesity treatment. And right now, South Carolina is not providing that. Expanding Medicaid coverage for obesity treatment, and then investing in community-based programs and education campaigns. And I think you're going to hear about that from our next guest, specifically related to childhood obesity. And then the final slide, again, well, I just lost my final slide, was is the just, by the numbers. So that is a huge number if you know, tally up all of those different areas. It's a significant cost to our state and to our employers and to our community members. So I think, you know, I don't know really next steps for this group, but I think just awareness and making sure that we are staying on top of the latest data coming out and discussing strategies that we could potentially become involved in. So that is it for me.
Great, thank you. Questions for Dr. Susan Johnson? Anyone? Well, thank you for that. We appreciate it. I mean, I know you said maybe not for this direct group, Susan, anything that as far as the city, and I'm certainly hearing you saying get the word out and this group get the word out, but anything that you can think of that the city council or our health and wellness group within the city, anything that you think we can do directly to help with this?
Again, I think having the conversations is incredibly important, and having conversations with multiple stakeholders as well. And it could be, you know, there are a couple different layers to this, but from the city perspective as an employer, you know, it might be something that Paul and his team want to take a look at, or the HR. You know, what are you doing currently? What are the resources for employees? Are there kind of red flags around stigma or weight bias within departments? You know, maybe it's having a workshop or something. So I think internally that's something that the city could do as an employer. And then for this group is just to continue to share information from our different perspectives and continue the conversation. I do think we're going to see more and more from more and more of a push for policy changes and from you know, our insurance providers to really look at what is currently covered. You know, you can't look at the news, you know, I mean, every day there's something about the prescription medications and access. And it really is, I think, really important for us to recognize that it requires a multi-pronged approach. You know, it's not just a behavioral change, lifestyle, access to healthy foods. Those are all things that we're doing and are important, but I think we also need to recognize that that's not enough for a lot of folks, and that they may need bariatric surgery or medications, and they need to be affordable, because if you look at the cost and the impact, I just think there's no denying that the benefits far outweigh the costs.
All right, great. Well, thank you. I appreciate that very much. Any other, Paul?
Hey, I thought one of her comments in that list was, looking at what we're doing in the community with community-based programs. And I know Tri United Way of Healthy Tri-County will be looking at that in late April. I think they have a meeting to re-implement get the program back on target. But I think that and finding ways to educate those programs and looking at how whoever's doing a promotion, whether it's DHEC or Healthy Tri-County or ecologists, but making sure we're all on board with knowing what those are, to know how we can be engaged in those things. I just think getting that inventory is very important first, to see who's doing what with obesity in our community.
Yeah.
And seeing what their needs are, so that we can support them, like Green Heart and I mean just Louie's kids, and just figuring out where they are and who they are, and then connecting those dots with our community members and putting it into your hands, but also putting it into our neighborhoods and other groups. So I think that's going to be an important step, and I'm looking forward to Healthy Tri-County, which Angela Johnson's on today, but I'm looking forward to how we start bringing those back together in a conversation.
Thank you so much for the opportunity. I do need to log off. I apologize for not being able to stay on for the meeting, although I might call in from my car, but so I can hear the rest of the meeting. But I also, since I won't be on for the community updates, just real quick, our South Carolina Healthy Business Challenge spring seminar series kicks off in a couple weeks, and the Low Country region event is on March 27th at the Harbor Club, and I will send out the flyer and the link to the registration later this afternoon. So hope to see y'all there.
Great. Thank you so much, Susan. Appreciate all that
All
you
right.
do. All right.
Thank you.
Thank you. And we're going to continue this subject with the state of childhood obesity with Holly Cutt. So Holly, if you would, please.
Yep, absolutely. Is this up?
Got it?
Yes, got it.
Okay, so just piggybacking off of what Susan had said, and this slideshow is really just going to take us through our children, not only in the state of South Carolina, but in Charleston County. And before I go through all of the slides, I think you will see some similarities. In your mind, sometimes we think, well, Charleston County has more resources and we have more open community use, or we have more ability for our kids to be active versus some of our rural counties. But when we look at the data that comes from the fitnessgram, we're not much off from what we see as an overall state statistic. So I think that's something to take note of. You know, when I do go through this, I didn't break down our statistics by school. I kept it as a district whole, just for confidentiality. But I think we can look at the state and we would be able to determine our rural areas, obviously, are going to have the higher cases of obesity in our children. So this here is the first basically stat of where all these numbers are coming from. So in the state of South Carolina, the State Department of Education requires that all of our districts do a fitness assessment for grades 2nd, 5th, 8th, and 9th grade. It is not required to use FitnessGram. So those districts who are not using FitnessGram are not part of this report. But the majority of the districts in the state of South Carolina are using this assessment. And you can see here the numbers, total number of students that were reported. This was in 2022, 2023, were just about 87,000. And those numbers will go down when you see the actual results, because of some of the data is skewed and some of it's missing. So then we just remove those students from that data. But this is basically the weight status. So if you were to have read the article that came out in the Post and Courier, this is where they were getting that information. So you can see that in the green, that if anything that's in green, that means those students are in the healthy weight zone, according to the Cooper Institute. So 61% of all the students in South Carolina are considered healthy weight. So that leaves that 39%, which the Post and Courier reported on, that are either overweight or obese. And you'll see that we have more obese children than we do overweight. And it also breaks it down by grade level, sex, race and ethnicity, and then our poverty status. This is for the state. And you can see that our white students have a higher level of healthy weight considered to any of the other race or ethnicities in Charleston County. And they break it down by grade level. So one thing to note too, in second graders do not do fitness assessment outside of just being measured for height and weight. That's the only data that is submitted. Not until you get to 5th grade do they start doing the assessments that go beyond height and weight. And that it's the other fundamentals of fitness: muscular endurance, cardiovascular endurance, and flexibility. Okay, so this just broke it down, and I will provide the links for anybody who wants the PowerPoint when I'm finished. But this is basically gives you all the types of factors that go into all the numbers. But as you can see, the overall number of the results from FitnessGram were actually almost 70,000, not the 87,000. So this breaks it down weight by sex. So girls in South Carolina versus the boys, it's not much difference at all. And when we look at the Charleston County, you'll see that it's the same. And then the bottom breaks it down by sex and race, poverty, and then by grade level. And this is just specific. This is the weight status in South Carolina of our children, just by race and ethnicity. So you can see that the trend is what you saw on the other. So our white students have a higher rate of the healthy weight zone versus our Black, Hispanic, and our other students. And this breaks it down by poverty status as well. And I think we can all make that correlation. This is something that we've already known, that students who live in poverty are going to have a higher rate of obesity just because of where they live, maybe in the food desert, or the ability to afford the healthier foods. So the state concluded that 2 out of 5 South Carolina students are overweight or obese. And I do think that that is something that we should be concerned about. The percentage of students achieving the healthy weight was basically the same in girls and boys, what you just saw. And the percentage of students achieving healthy weight was lower in Black and Hispanic students than white and other race ethnicities. The percentage of second grade students achieving healthy weight was greater than the percentage among students at the other grade levels. And to me, that's a little concerning too, because that just what that's saying is the kids are getting heavier as they get older, which could be other factors, is more food consumption, less activity, medical reasons. And the percentage of students achieving healthy weight was lower among students in poverty compared to those who are not. And again, this just breaks it down. All of this information that you're seeing is coming from the FitnessGram site from DHEC on the state report. And the newest state report should be coming out soon based on last year's scores. So the scores that you're getting ready to see for Charleston County are from 21-22. And so this is the first look at Charleston County. And this is what this FitnessGram will send us, and they send every school district that reports numbers. Although all of our schools are required to report their FitnessGram assessments to the state, sometimes there are mishaps. Sometimes technology doesn't work, logins don't work, new teachers aren't in the system. So we do have a couple issues. So the percentage that you see for Charleston County is not, it's not including every single one of our kids. And another factor that we take in as well, in our middle schools, not all of our middle school students are enrolled in PE. So if they're not enrolled in PE, they're not part of the program as well. But what you'll see is it breaks it down. I've got my arrow on the healthy weight, overweight and obese. And so for second grade, you'll see that the healthy weight is the 68%. So this is where that's status was coming in for the state and Charleston County trends. So it goes, down. We have less students in 5th grade, and then we have less students in 8th grade. It picks back up in high school. Again, this can be part of the reporting process of scores. More scores were going in than we had in middle school, or less scores, things like that. We also do a pre and post test with the high school, whereas our elementary schools, we just do 1 test per year. So basically for that year, and I know at the top of it says 2020, 2021, but it's actually 2021, 2022. That was an error on the state part. But we hit 57% of our 5th graders were in good cardiorespiratory fitness, whereas our 8th graders, it was 41%, and then it went back up to 55% of our high schools. And again, this is of the students who were tested. And to test the cardiorespiratory fitness of these students, they either participate in what's called the pacer, or they participate in the mile run. And the high school students do a pre and post. They sometimes do a benchmark. Some high schools have them participate in this every week, and they take the scores. Whereas our elementary schools, that pacer test is completed once. At any point during the year that the teacher has the time to do that. And another note too, with the scores for elementary, the students in elementary school are required by state mandate to get 90 minutes of PE per week. However, some of them don't get to that point, and many of our schools see the PE teacher just once a week, just like they would art and music. So when you have 180 days of school and they only see them once a week, the PE teacher is really only seeing the kids 36 times per year. So that's something to think about too. And this is overall the district as a whole, that you can see the data that came from the same year. Actually, this was last year's data. You'll see the 2023. This is what I can run on my end as a report versus what the state gives me. So based on all of our schools who reported last year, you can see the percentage of body composition, because that's really what we're looking at. And you'll see, so we got boys 62%, the girls 63%, and a total of 62% in the healthy fitness zone. That's right on par with what the state department was reporting for overall of all the districts who are participating in the fitnessgram. And then this just breaks it down of where the percentages are of students who need improvement. And so anything that's in the red, that's the percentage of what it looks like fitness-wise overall with our students. And then this breaks it down by year. So this is a 3-year comparison. So you can go back and look at the difference that's from 2020 to 2021 to 2022. Not much change. Not much change at all. So actually it's gone down a little bit. In this 2020 year, we were coming out of the pandemic. So that's something to be said. As you can see, pretty much in every area, we've gone down. And the goal is we want to go back up. And again, so there's the comparison for 2 of the years, the 2021, 2022. So we have gone up overall in aerobic capacity and abdominal strength. And the aerobic capacity, to me, that's a good thing to go up, because, you know, cardiovascular endurance is one of the more important types of movement that we focus on with our students, and getting the heart to be healthy. When you can get that, everything kind of just falls in place with the other components of fitness. But as you can see in the body composition, the weight that we're concerned about, there was no movement. It didn't go up or down. And then this just compares it by grade level for body composition. And so you can see it's about the same across the, I mean, there's a little bit, but when they get to 9th grader, we have more students who are in the healthy fitness zone than they were in the 5th grade. But if we had 2nd grade on there, you would see that the 2nd grade would be higher than 9th grade. Okay, and so this is just for you to be aware. So these are, the link is at the top, the standards for PE, but these are the time requirements that the State Department of Education ask all schools to have. So for kindergarten through 5th grade, they're asking 90 minutes of PE and 60 minutes of planned physical activity. That would include, it could be structured or unstructured recess. Middle grades, there's not an actual time. It's recommended based on the national standards that middle school students right now get 225 minutes, same as high school per week. But the state doesn't require time for middle school PE right now. They just require students be enrolled in PE. And then our high school students have to have at least 1 Carnegie unit of PE just to graduate. So what that means is they take it once, typically their freshman year. It can be a semester. Some schools have it as a year-long course, and then that's it. If they come back to PE for a 2nd, 3rd, 4th time, they do get credit for that, but it's not required for graduation. So we do lose the majority of our students after that first Carnegie unit has been covered. And we see majority of our athletes who come back to us just for varsity sports, typically weight training and things like that. We do have some schools who offer other PEs for students who are not athletes, and that's what we want. We want them to come back to us. And the State Department of Education is actually looking at, in the next few years, hopefully, I don't think next year it's going to happen, but hopefully next year, but they're going to start offering some honors PE. That'll be a PE 2, 3, or 4. So students can get those higher weighted credits and not necessarily be with weight training. So we can more of a personal fitness class or a class that could get them closer to being a personal trainer, or the kinesiology type classes, which I think will be good for our numbers and get our kids to come back to us after they've had their requirement. So these are the elementary schools that were in 100% compliance for mandated time in PE and recess. So we had 4 last year, and when this elementary schools meet that 100%, that means they got 90 minutes per week, every student, and they got all the recess time in that's required. The State Department will come down. So in that picture, that's one of the PE teachers over at Stiles Point Elementary, and that is Dr. Meadamaw. He is the state rep for health and PE for South Carolina, and he came and visited each one of those schools who met that mandate. That's the first year that the state has done that, so that was really cool. And I'm sure you guys are aware of this. This was also in the Post and Courier, but this is the new bill that is on legislative floor right now. And if it does pass, it's basically going to change some of the time limits that are required for PE. So it's going to be up to 60 hours a year for middle school. That's the big one, because right now there's not even a time that's required for middle school PE. Again, they just have to offer it at the school. So that's it says about 20 minutes per school day. Scheduling will look different because the way middle school PE is scheduled, it's just like all the other courses. It's a quarter course, or maybe a semester course. Some schools might have it as a year-long course. Just depends on the size of the school and how the master schedule is set up. But if a kid takes it for a quarter and the quarter's over and they don't have PE anymore, that would fall into their year and not necessarily the 20 minutes per day. That would be impossible for that school to reach. But that's something that we need to look at. I think that's a good thing. I do think that there will be a lot of needs to be conversation about how that's going to happen. If we are going to increase the minutes for our elementary and middle school PE, we're going to need more teachers. Schedules are going to have to look different. The funding is always going to be the biggest part. We can change laws all the time, but if there's no funding behind it, it's not going to happen on the ground. But anyhow, so on this site up here, so this website at the top, the link, this is where I got all the information from the State Department. But they also have these great flyers that are linked here. There's one that's for what schools can do, one that what the community leaders can do, and then what families can do. And all of these links take you to ideas of ways to get people more active in the community and eating healthier. I'll come back to, actually, I'll click on this one right here, just the community one. Okay, maybe not. Here we go. So you'll see it's going to bring you to a flyer, and some of you may be familiar with this, but it just gives some conversation pieces of ways to get people out into the community to be active, and how to partner. And Fitnessgram, the Cooper Institute, and DHEC have worked together, and they've done a great job to put things like this, for people like yourself on the wellness committees to look at and make some decisions. And Healthier Generation is also another community, not community resource, but just nationwide resource that can help you as well, is finding ways to get the word out. And that's it. I don't have anything else for you. I do think that one of the things I took from Susan's, what she was saying is that we see is in the increased absenteeism in the workforce. That's something that we also see, in schools too. And that's, obviously with the schools, they're not losing out on, money, but they're losing out on academic activity, and gains that the students are missing from the chronic absenteeism when it is due to their health. But I'm
Great.
ready for any questions if you have any.
Great. Thank you, Holly. Questions?
Kevin?
Paul?
Holly, can you just briefly talk about the school wellness program that the Boeing
Sure.
Center is doing?
Yeah, absolutely. So we had the wellness initiative through the MUSC and the Boeing Center. Our schools participate that. Not all of them do. It's not required, but the majority of them do. And with that, it is a checklist of items that we encourage the schools to meet. And there's different areas. There's a nutrition area, there's a mental health and wellness area, there's a physical activity area. We even have sprinkled out, to cover alcohol, tobacco, and drugs and things like that. But the goal is to provide opportunities at the school for just basically awareness of wellness, something as far as making sure that there's a lactation room at every school for nursing mothers. Do you have a calming room, a place where students can go if they need to just chill out or they just need a mental break? Does your school meet the minutes, for health and PE? That would be a check off. Does your school provide some type of campaign or fundraising event that's geared towards any area of wellness? It's as we've gone through this over the 12, 15 years that we've been doing this, the list gets longer and longer of more opportunities for students to, for schools to check off the list. So what they do is they tally up the list, they log it in, and they get points for everything that they log. Some things are worth more than others, depending on what it. But at the end, the tally comes through, and then our top schools get granted money from MUSC and Boeing that goes back towards their wellness committee for the school. Our top prize is about $2,500, and then we go down to $1,500, then $1,000, and then this year we're having a Rising Star Award that'll get $1,000, and then everybody, regardless of what your score is, as long as you participated, will get some small chunk of money if you reach a certain amount. Typically, that it's as long as you reach, I believe it's like 200 points, you get like $250 to $500. And this is all funded through Boeing and USC. And that's a big thing too, is getting the funding to do this. And we wish we could give schools more, but whatever they do with the money, it has to go back to the school and used within the wellness committee. They can't use it to fund, something else that doesn't, they can't fund an end of year party for a classroom or anything like that to buy cupcakes. It has to go back to the wellness committee that would help reach out to everybody in the school. Some of the schools might use it to buy, some yoga mats for their wellness room that strictly for teachers. Maybe they found a massaging chair that they can put in there for teachers when they have a break, or maybe they're going to use it to hire a yoga instructor to come teach a class to the faculty or staff before or after school. Anything that would promote health back to the staff or the students is where that money goes. But it's been great, and it really is a good awareness. And Lindsay O'Neill is our rep for Charleston County from MUSC, and she sends out weekly newsletters to the wellness leaders. Just here's all the grants you can apply for, and this is what's going on. Look what this school's doing, and just kind of get it out. And some schools have taken it and they just love it, and it really has made a difference in the climate at the school. And what we want is we want all of our schools to be part of it. So the more that we can spread, hey, look what we're doing, people pick up on it and they're like, oh, but a lot of schools are already doing a lot of this stuff. They're just not part of it because it does take a lot to log everything. Our next big event that schools can get points for is going to be not next week, but starting March 18th through 22nd. It is National Alcohol and Drug Facts Week. And we have all kinds of activities that our schools can participate in, elementary all the way through high school, and get points onto this wellness initiative by doing some of the activities that we have planned for them. Down to just, little morning announcements each day. We have contests for the kids to participate in. We've got some lessons that teachers can use in the class that week. All kinds of great stuff to, positive social norm side of, preventing substance abuse.
Okay. Morgan.
Thanks, Holly. That was really interesting and informative. Greatly appreciate it. My name's Morgan. I'm at the College of Charleston. I used FitnessGram data and some research previously, but in the upstate of South Carolina. So one, I'd just be interested in connecting. My question is about, so we had 4 schools in Charleston County School District that had 100% compliance. Would we be able to see if their data is better in some of these outcomes with the cardiorespiratory fitness or weight status? So that was one part of that question. And what is the big barrier? What is the difficulty in other schools getting to that compliance for the policy in time
Yeah.
spent?
Yep. So I can definitely pull there's that data, and we can chat later and just to see. But honestly, you're going to see discrepancies between all of those schools because they're all kind of spread out across the district. And when the teachers only get to see the students once or maybe twice a week, the outcome of data isn't going to change with what's happening in the classroom. It has to come from everywhere. Those kids have to be moving outside of school. They have to be doing other stuff for the data to change. It can't happen in the 45 minutes that they see them for the 36 times a week. So that's where the wellness committee comes in and definitely can help promote that. But as far as the barriers is time. It's a scheduling time, and it's funding. We have some really large schools and that might have 1 to 2 PE teachers, but in reality, to get to the 90 minutes a week that the state wants, we would have to have 4 PE teachers at that school. And then, that class is now going to that PE for more minutes than what they might have going to art or music or whatever other elective they have that aren't mandated. And it's really hard for a school to schedule that way, because they try to keep everything on 45-minute blocks, and it does become a big headache, but there's ways around it, and those 4 schools have figured it out. I have a feeling that next year we might even have some more schools that are on that list because they have figured out where there's openings and how they can get the kids an extra PE or more movement in the day. But that's really the biggest barrier. And even if the funding was there's not always teachers out there to fill it. We have a hard time filling those spots, already as it is. And just look at College Charleston, they've dropped their health and PE department. So we don't have any kids coming out of CFC now who can student teach and be part of that program to come back to us, which we would love. You go over to the Citadel, their numbers are getting lower as well. And so that's a little bit scarier. And that's not just health and PE, that's education overall. But that's where we are. So I love that these bills are on the floor, but I think there's more conversation that go around it of if it passes, how is the State Department going to support it, and how are schools going to be able to support it as well? That every subject has time behind it. You need 70 minutes in math, 70 minutes in science and ELA, and if everything starts having minutes, sometimes the minutes are going to go beyond what we have in a school day. So where do we knock those off? Like what subject area doesn't want to be compliant? And academics is really, really important, but we also know that movement is too. And, I think instead of looking at the barriers of schools who can't get the 90 minutes, I think it would be great to see those who are. What are their test scores looking like as the years have gone on? Are they increasing? Are they doing a better job because the kids are getting more movement in the school day versus some of the other schools? And are they participating in the wellness programs? There's all kinds of, faucets that could go into the academic gains that a school will have.
I think Nick Osborne has a question.
Yeah, no, thanks very much. And thanks, Holly. And again, maybe it's less of a question, but more of a comment and a thought. And just thinking about what sort of role and engagement is there, or conversations from a private sector perspective in terms of the engagement of health insurance companies, for example. And I think about this from the perspective of what Susan presented as well, with all this data around the economic impact and the social impact of obesity, right through all ages, and especially with a focus on children. Is there, in the state here, is there any opportunities for engaging or working with the health insurance companies and finding out what their interests might be, and thinking about what sort of opportunities there might be for engagement, especially when it comes to things like funding and supporting programs?
Sure. That's a really good question. And what I can tell you is right now, we have our employees, we're going through, it's called the Healthy Weight Challenge with, it's part of MUSC, but the insurance company, as long as, because all the teachers are covered by PIBA. So they're funding part of that. The teachers did have to put in a little bit, but that challenge is providing webinars during their lunch hour on nutrition and things like that. So this is the first year that we've started that. And there will be compensation for the challenge. They're on teams of 4, and this is a nationwide challenge too. It's not just, South Carolina. So anybody could have been part of this, and they do it several times a year, but MUSC has partnered with them to help our employees offer different types of webinars, whether it's mental health, like I said, nutrition, things like that. But as far as it goes beyond there, I'm not real sure what our insurance companies are doing to help fund change, whether it be for our children or for employees. But I feel like this year we have a little bit of a start. That's the first time that, really that our insurance company has been part of making these changes for our employees. I wish I could tell you more, but I can't.
Holly, do you have a list of the schools that have been awarded that are in the city of Charleston? And the reason why I say that is there may be some further public recognition the city could do for those schools that are within the city limits possibly.
Sure. I can get you the list that we've had for all the past years. And we will be awarding this year's recipients in May. So when that comes, I think that would be a good place to start with this year. And then we do a media release, and I can send those about, and then maybe you guys can send that out as well. And usually, I don't think she always puts it in there, but typically some of those are posted in the MUSC Boeing's full report for the year as well.
Okay, great. Yeah, thank you. All right, anyone else? Well, Holly, thank you very much. Great information, and appreciate all the work that you do. So thank you very much.
Thank you.
All right, we'll move on our agenda to our community health update, and we'll call on Dr. Katie Richardson, please.
Thank you. So in the interest of time, I think I'm just going to touch on a few subjects, and if anything, if anyone wants more information before the next meeting, you can reach out to me personally. Or if you want to hear about something more at the next meeting, just let Paul know. I think I'll start with the change in CDC guidance around COVID. That came out on Friday afternoon, and the CDC website has been updated. It's under respiratory illnesses. And basically, I think that's the theme, that COVID will now be treated more similarly to other respiratory illnesses, including flu and RSV. And I think the biggest take home for many people is there's no longer a recommendation for a firm 5 days of isolation after symptom onset or testing positive. The recommendation will be the same for all of those respiratory illnesses, which is once someone has an improvement of their symptoms and no fever for 24 hours without fever reducing medications, they are able to return to school or work as long as they're not in a healthcare facility or a healthcare setting with 5 days of additional precautions. And that includes distancing, potentially masking, thinking about treatment if there's been a diagnosis of COVID or flu. So happy to talk about that more, but I think they've done a great job. I think with the website, I think they've made it simpler, easier to understand, concise. So check that out or ask me if you've got any questions. Around the same time, there's also been a recommendation by the CDC for another COVID booster. So the same monovalent booster that came out in the fall, but the recommendation for an additional booster for those age 65 and over. There's already been a recommendation for those who are immunocompromised, but this was a second group that has now been recommended. And that's really a large part of why this guidance was updated, is that we now have effective immunizations against not only COVID, but also flu and RSV. We have effective treatments, and we have more knowledge about core prevention strategies that can protect those who are more vulnerable and all of us from spreading it. So I think that's all I'll say about that. I also wanted to mention that all DHEC health departments have a free sexually transmitted infection and HIV testing day on March the 12th. That is in honor of National Women and Girls HIV Awareness Day. That day happens on the 10th, but the free testing day at all DHEC clinics is on the 12th. I'll talk a little bit next time about West Nile virus and how the public can help us to track the spread of that virus in our communities by submitting dead songbirds to DHEC for testing. So if you find one and you would like to think about submitting, just check out the DHEC website or reach out to me. And lastly, Angela may mention it as well, but I wanted to put a plug in. Paul sent out information about Trident United Way function that's coming up on April the 26th from 9 to 12 p.m. at Royal Missionary Baptist Church. DHEC will be sharing lots of data on that day. And we would love for all on this committee to come out and review that data with us and talk about ways that we can use it to inform public health priorities here in the city of Charleston. Thank you.
You're muted, Kevin.
I'm sorry, I didn't realize I was muted. I was just talking along, but thank you, Dr. Katie Richardson. Appreciate that. Some good news in there, and we appreciate all that you do for us and sharing that information. So thank you. Any questions before I move on? Great. All right. So we've come to our community health and wellness updates, and I'll just, if anyone wants to chime in, just raise your hand or holler out. Anything from your individual perspective, let us know.
Yeah. Angela, I'm gonna ask you,
Yes.
I'm gonna give an invite on the Healthy Tri-County.
Yes, thanks, Paul and Kevin. Good morning, everyone. And thank you, Katie, for the plug. Dr. Katie, we appreciate that. Yeah, we're very excited that Healthy Tri-County will be hosting a relaunch event on April 26th from 9 to 12 at Royal Missionary Baptist Church, as Dr. Katie announced a few minutes ago. This is an opportunity just for Healthy Tri-County to kind of get re-engaged with our members again after a little bit of a hiatus, and to spend some time with DHEC going over the data, doing a data walk. So we would love for all of you all to make it over to Royal and I'm going to say Mount Pleasant and North Charleston that day. It should be a really good time for networking, connecting, and getting some information and just kind of learning where Healthy Tri-County will be moving in this year, what our agenda will be for this year.
Great. Thank you, Angel. Any questions there? I do see in the notes that Paul had put on here, I'm not sure if you could see that, if it just came directly to me, but that Quentin Tompkins wanted to remind the group that the MUSC Senior Expo is a week from today from 9 a.m. to 1 p.m. at the Convention Center. City employees from Charleston, Mount Pleasant, and North Charleston will be stepping it up for fitness during the bridge run starting on March 28th to April 6th. The challenge will be a steps challenge to see which city employees team can get the most average steps during the 10-day period. It's all about stepping it up for a healthy workplace. So I wanted to certainly share that. Anyone else have anything to report to this committee? Well, I know I say it a lot, but I can't say it enough. I very much appreciate the time and the commitment that this excellent group shares with the city of Charleston. We very much appreciate all that each of you do, and that you spend time with us so that we can continue to make the city of Charleston a healthier place to live. So certainly appreciate everybody's time and everybody's effort to make this committee as great as it is. So if there's nothing else to come before this committee, we will stand adjourned. Thank you very much.